So I want to talk to you a little bit about your syllabus and my expectations for you as it relates to our course together. What I would suggest at this point, if you don't already, I would pull your syllabus up or look at a copy of your syllabus and have it available for you as we go through these slides. I'm not going to go in depth with everything on your syllabus. As you can see, it's a lengthy syllabus. It contains a lot of information. I won't bore you by reading it to you because I'm sure you're all adults and you can read it yourself, but I do want to hit some of the highlights. So pull that up and take a look as we go through. When you look at your syllabus, there's really kind of 5 basic parts to it. What I consider the basics: information about me, information about office hours, all those things. There's the heart of the syllabus, what I consider to be the things that students are generally the most interested in. What are we going to have to do? What are we going to be doing? What's the content of the course? What will we cover, etc.? How will I be graded? There's a section on personal policies. So these are policies specific to my course and specific to me as an instructor. Then there's a whole list of department, college, program policies in the syllabus as well. And then finally, the informed consent form. I'm going to go through some of these in greater depth, all of them, but some of them in greater depth here with you as we move through this. Let's start with the basics. If you look on the front page of your syllabus, you can see, obviously, you all know my name, you know when we're going to meet, you know where we're going to meet. Some of the things in that particular section that you might not be aware of, I did include our departmental website. I include the required course textbook. As I've said in some email exchanges, that Deliberate Practice in Cognitive Behavioral Therapy book can be downloaded through our university library website, the Psych Books in particular. Psych Books is a great resource that you may not know about. It has thousands and thousands of books published by APA that you can download and read for free. It's a great, great resource. So you can find that there. I would download a copy of the book and just have it available for yourself. Most, if not all of our readings outside of that one will be highlighted on Canvas or available to you on Canvas. The other thing that I'll point out in terms of the basics, you have a class email. It's section psy03712-1 at list.rowan.edu. If you don't catch that, it's on your syllabus, obviously. If you wanted to email the whole class, you can actually just use that that section email. And you guys probably all have each other in a group email, so it's not a big deal. You just include me in that. But it might be helpful when you start teaching to know that each of your classes would have a specific email address like that you can email your whole class in one swoop. So that's always available to you via Rowan, so that might be more helpful than for our class. On to the heart of the syllabus. These are the things that students, again, are most interested in. I'm not going to read you the course description, but I would encourage you to read it. The purpose of this course is really to introduce you to, as the course name implies, adult evidence-based interventions. When we initially designed this program, this was specifically supposed to be an adult-based program. And this course was one of 2, the adult, and then there was a child adolescent. I'm going to try, just based on feedback from previous years, to kind of throw in some child adolescent stuff as we go through. It will not be the main focus of what we do, but I'm going to try and throw in some readings and to kind of try and discuss it a little bit more than I have in previous years. It's really outside of the scope of this class as it's designed, but I want some of you who are going to be working with children and adolescents to have a basic kind of foundational knowledge in their area. So I will go into that. If you look through the course objectives, and again, I keep saying this, but I'm not going to read this to you. You guys can read through this. The objectives of this are multifaceted. One is to give you an idea of the various theories and techniques out there as it relates to doing psychotherapy. The other is to give you kind of a space and a time and a place where you guys can discuss and debate and talk about the issues related to psychotherapy work, whether they be fears that you have, whether they be controversies in the field, whether they be misunderstandings that you might have about the reading, whatever it is. My hope by doing some of these pre-lecture lectures is to kind of free up some more space so that we can talk about some of these things. The other thing that I'm trying really hard to do this year that I've done in previous years, but students keep telling me they want more, so I'm going to really try and do this, is I'm going to try and do a lot more demonstration-based work, and I'm going to have you guys working on some skill-based work, kind of like you did in your first intervention course last semester, but probably with a little different flair for what you did in there. So hopefully you kind of come out with a better kind of sense of like, I can do this and I have the kind of fundamental skills. I've worked really hard in selecting readings to make sure that you've got readings that are reflective of skill-based learning, so things that you can use not only for our class but into the future. And so I would certainly save all the things that we have here so that you can reference them as you continue to go through your training and into your practicum work. The final thing I'll say about our course objectives is I like to, right now at the beginning and throughout our time together, to emphasize the role of multiculturalism and DEI work as we kind of progress through our semester. I really have always thought of this, but I've increasingly tried to emphasize the idea that multiculturalism is not something we talk about for a course. It's not something that we talk about once. It's something that's embedded in everything that we talk about. It's embedded in the understanding that everything we look at and everything that we do is through the lens of a certain worldview in our own sense of privilege and place in our world. So I like at the beginning to kind of emphasize that that's a continued part of our discussion. I will say to you, I don't know everything. I know a lot. I work really hard to kind of make sure that multiculturalism and understanding that as part of our lectures and part of the things that we talk about. I own my own privilege. I own my own identity, and I realize that my own privilege and my own identity sometimes puts me with blinders on. So I'm happy to kind of explore my own blinders and my own kind of limits to my knowledge, and I hope that you are able to do that with me. My hope in this course is that we have an open dialogue and an inviting dialogue, sometimes a challenging dialogue about any of those issues, but certainly that is a very, very key component to what we will be doing. If you look at your course assignments, expectations, and requirements, I'm going to give you a lot of reading. You already know this. You've already looked at the first couple of weeks. You know that there's a lot of stuff that I'm going to give you. As I said to you, I work really hard to kind of find readings that incorporate clinical material in it, how-to instructions about how to do things, but also a fair amount of theory, so that you can understand how to think about these various concepts and these various theories that we talk about. I know that you probably will not read everything word for word in this class. I will try at times to guide you in terms of where you should focus your reading, where you should focus your reading efforts. I will be a liar if I say I will always be able to do that every single week, but I will try my best to guide you in what we're talking about and what you should focus your attention to. If you look through, and actually you don't have this yet, but when I get your course reading list out in your topical list, you'll notice that there are what I'll call brief topics and special topics, and then there's also a research spotlight. Brief topics are things that we don't have a lot of time to cover, but I think are really important. I'll give you one example, and that is like, how do I assess outcomes? How do I know if my clients are getting better? I could spend a semester talking about that, but we don't have enough time. Is that the key thing you need to get going in your psychotherapy work? Probably not. But I think it's important enough that I want to say, here's what assessing outcomes means. Here's how you might do it. Here's some additional reading that you might want to look into. Then we have special topics. Special topics are topics that don't kind of fit into anything that we're talking about that particular day or even in the semester, but that are just like relevant to the psychotherapy world. The best example I can give you there is and you've read about this already, the controversy between science and practice. Um, Psychotherapy is for years and years and years debated how to integrate these things. How do we integrate science and practice into our work as clinical psychologists? I can tell you right now, sorry to bury the lead, nobody has the answer to that, right? But it's something that we'll talk about and we'll spend a special topic time in particular looking at and reading some about that. And then finally, you're going to have what I call research spotlights. You're going to get research articles assigned to you. And the focus you're going to have for these research articles are on the methodology that these scientists use when examining the process and outcome of psychotherapy. And so my hope here is to kind of give you a sense of all the different ways that psychotherapy researchers are looking at the questions relevant to psychotherapy practice. My hope is that this gives you a little bit of an insight into the methodology, not only that's being used in the field, but that you might use in your research work, your thesis, your dissertation. Obviously, this will be brief because this is not a research methods course, but I would feel remiss if I didn't kind of talk about research and psychotherapy research along the way. So as you know, you'll be required over the course of the semester to listen to a number of pre-recorded lectures like this, and I will also be listing a number of videos, some of which will be optional for you, and those will be noted in Canvas, and some of which I'm going to actually require you to look at before we come to class so that we can talk about them in class together. I try to make the lectures as brief as possible. As you get to know me, you know I love to talk, and psychotherapy is something that excites me and I can talk about forever. So I will try and keep them brief, but I also like to have these for things that you can kind of come back to both now and later in your training if you should want to, and if you should find them useful, which I hope you do. I think the Canvas shell kind of goes away eventually, so if you find something helpful and you think that it might be something you want to use later, I would encourage you to download it and try and use it someplace else. The reason I've gone over to YouTube, and I'm trying to, excuse me, is so that they're not Canvas dependent. So you can get them outside of Canvas. But some of the YouTube videos that I post, they're obviously on YouTube as well, but you'll lose the link to them if you don't link or download the link from the Canvas shell. Something new to the class this year, and the reason I've gone to some of the online lectures and video presentations prior to class, is I want to free up some time and do some things to kind of get you to practice some of the skills that we've talked about and some of the skills that you're reading about. Most weeks you're going to have what I'm calling a skill assignment. And what this means is you're going to work with either 2 to 3 of your classmates, and you're going to be assigned a particular skill or set of skills to practice for that week. I have I've been back and forth with this over the years and in terms of how to do this and what's the best way to do it. And I don't have all the answers, but we're gonna try. One of the models, as you read about, or you'll read about in week 2, is the deliberate practice model. And I'll talk more about that in another lecture. But the deliberate practice model, in brief, is the idea of practicing in small, short segments instead of trying to kind of mimic a full therapeutic session. So you'll be working with a classmate, you'll be posting those videos online for me to look at, and I'll be providing feedback to you about those. I can tell you that just because it takes so much time, I will not be able to give you extensive feedback individually for each of them. I will look at everyone's video and then I'll try to provide some group-based feedback. And when and if I do have kind of time, I will try to give some individualized feedback as well. The exception to this will be our kind of final project. We'll have a final skill session, which will do more of a mock interview or mock session, but it'll still only be about 15 minutes. I haven't decided whether I want to do those in class or whether you're going to do them outside of class at this time. I know doing skills and practicing skills can be painful. It can be anxiety provoking. I will try to practice myself with you in class to see that even, and I would consider myself to be a very good skilled clinician, and even someone who, like myself, who's been practicing for a long time and I think does very well as a clinician, doesn't always go in the right direction. Is sometimes kind of caught off guard by clients. I was caught off guard this past week in a therapy session, and wasn't quite sure where to go and didn't necessarily like where I did go. So it's just a constant process of learning. So that's the purpose of the in class as well as outside of class skills practice, is to get you feeling more confident and to get you more comfortable in some of the key skills that you will use as a beginning clinician. Let's shift over to specific course assignments that you'll have over the course of this semester. As you can see, we've got a busy semester in front of us. One thing that I expect of you each week is that you come to class prepared and ready to participate in class. I will have a reflection that you will be asked to do each week. And the other thing that I am really big on that you will come to know is the idea of reflective learning. So I really believe that we learn very well by reflecting on what we're looking at, what we're reading, what we're doing. So I ask you to do a fair amount of reflection about the work that you've looked at and the things that you've looked at. I do realize that sometimes things get busy, so I've allowed you to kind of skip that reflection uh, piece at least 2 times over the course of the semester. I don't care when you do it, why you do it. It just won't show up in your online folder for me. I will provide you with a number of homework assignments over the course of the semester. Those will be worth 200 points total toward your grade. The homework assignments are largely meant to, again, give you kind of practice doing some of the things that we've talked about, but using you as the subject. So for example, one of the assignments, you'll trace your automatic thinking and your emotional states over the course of actually a couple of weeks, and try to modify your own cognitions in the same way that you would ask your clients to do it. I'll introduce those usually a week before the assignment is due so that you can ask questions the week before in class. We talked about the skill-based assignments. Those are worth 300 points total. And then we'll do a final conceptualization and treatment plan, which will be worth 100 points. Excuse me. One of the things that you've already come to know that I emphasize is the idea of thinking about your clients, conceptualizing what's going on, and making sure that you're understanding, both at the macro level in terms of like a diagnostic conceptualization, but also the micro level. So when a client walks into your office and says, you know what, last week was a crummy week for me, and I got into this horrible fight with my son. And at a micro level, you're going to be thinking in your mind of, why did this fight happen? What were the antecedents to it? What were the precipitants? What were the consequences of the fight? How did the client communicate in it? What was their history of their relationship? That's the micro level. Like right now, when my client's talking about this thing happening in in their life, in my life maybe, how do I understand that? And then the final thing we'll have, and I've gone back and forth with this over the semester. This is the one I love and hate, but we'll have a content exam. And this will be a take-home examination. There'll be multiple aspects to it. It'll be toward the end of the semester, and it will ask you to kind of go back and review the information that we've talked about or talked about in class. I will do a mixture of kind of essay, short answer, multiple choice questions in that. So busy time, lots of work. You'll need to kind of appropriate your time accordingly. You can see, I won't go through this in much, your general grading considerations. You take all your points, whatever you get, you add it up, you divide it by 920, and wherever you fall on that A to F grading scale is the grade that you get. You know, in our program, you need to achieve at least a B- or above in order to pass this class. If not, you'll need to retake it, and there are other consequences depending on how you do in other courses. So it's imperative that you keep on top of your grade. and that you know where you're at any given time. I hate that grades are anxiety provoking. I really think of this as a competency based course, and my goal is for you to achieve the minimal level of competency. That minimal level of competency is a B minus. And minimal level of competency is nothing to be ashamed of, by the way. I think graduate students have a difficult time with that concept. Minimum level of competency simply means that I've met the competency deemed by my profession to be competent, right? Period. You know, the reason we attach the minimal part to it because it's the lowest level of that competency that you can be at. But it's nothing to be ashamed of and nothing to worry about. I know that won't help some of you because you're all high achievers anyway, but I like to say it anyway. I'm going to go really quickly through these next couple of sections, largely because you can read them and they're all pretty self-explanatory and pretty clear, I hope, on the syllabus. A couple of things to note. Number one, my expectation is things are handed on time. Late assignments are not accepted. If you're having difficulty, if you're having problems getting things on time, some things come up, communicate with me, but don't assume that a late assignment will be kept or will be accepted. It's up to you to kind of make sure that you're trying to get me beforehand, and don't do it at the beginning of class, right? I can't make decisions right there at the beginning of class when I'm trying to get things ready. So it's important to kind of make sure you're managing your time and make sure that you're communicating with me ahead of time. I run this course in very much a discussion focused. The reason I'm doing the pre-recorded lectures is to kind of open up time in class to have more discussion and time to talk about the material. So I expect that you're going to come to class prepared. I expect all of our communications in class to be professional, cordial, and appropriate. I do not like passive aggressiveness. I do not like aggressiveness. I do not like yelling at one another. Some conversations can be uncomfortable and we may have differing opinions on things, but when and if we do, whether this is me and you, whether this is you and your classmates, I expect that to be done in a professional, cordial, and productive way, right? So that we can learn and grow together. Instead of, sneer and snark and be nasty toward one another. So I will do my best to facilitate that type of atmosphere. If I feel like you're doing something that's interfering with that atmosphere, I will have a discussion with you about that. It's also part of our professional competencies as clinicians and as a training program. So how you communicate with other people, including me and your colleagues in this class, is part of how you're evaluated in the program as well as part of our classroom. If you feel uncomfortable with anything that I've said or I've done, I would encourage you to come talk to me about that. If we need to have a third party present to talk about that, we can do that. Hopefully it doesn't get to that level. I am very much a proponent of proactive communication versus kind of having something sit and harbor resentment and feel bad. I don't want any of you sitting in class feeling bad. So if there's something going on, talk to me, talk to someone, and let's get it resolved. I do have office hours that are listed there. I prefer you kind of let me know if you're going to stop in, just so I can make sure I'm going to be there and make sure that there's nobody else scheduled during your time. As all of you know, I'm extremely busy, but you are priority in terms of time and my time and getting FaceTime with me. So if you need me, reach out. I'm there often. Wednesdays, Thursdays, and then Mondays and Fridays are other days that I'm available. They can be more or less flexible depending on what particular week it is. Email, when you're emailing for this course, you email myhaw@rowan.edu. So don't use the clinical one. I know that's a bit confusing, but Sherry and Dr. Jones don't want to answer my class email. So if you're emailing about this class, use my personal email, haw@rowan.edu. I will use email, as you've already seen, to make class announcements, so it's expected that you're checking them regularly. The last thing I'll say is computers and cell phones. Don't surf in my class. I think one of the remnants of working at home and the pandemic is people are used to kind of multitasking and doing many things at once. If I see you surfing, I will confront you. If it's really blatant, I'll do it in the middle of class. I don't care. I find it rude. I wouldn't do it myself if you were talking to me, so I wouldn't expect that you're doing it. So, I don't know, period. Don't do that. I'll get to dual roles in a second. Okay. So there's a whole list at the end of your syllabus of course and university resources and policies that are available to you. I will note that some of these are simply meant to inform you and educate you. Some of them are meant to guide you in the right direction should you need campus resources. There are resources that are both academic and personal in nature. So there's things about how to get support and how to find kind of support within the program, whether that be emotional. I think there's some in there about food. There's some in there about, disability resources. So there's a whole bunch of things that kind of point you in different directions within the university. Of course, that's not comprehensive. There are other things at the university and websites that you can go to find out more about that. But I love to give you some things that point you in the right direction. Excuse me, I'm sorry. I'm still struggling a little bit with this cold. The university course policies and procedures are there as well. Most of these are consistent with our program policies. If the program policy is different, the program policy would trump the university policy. So that's just a piece of information that's in your handbook as well. If there's religious observances, conferences that you have to go to, other things that kind of overlap with our course, please talk to me about those. Obviously, I will be flexible with you, certainly with the religious observances and other things that you might need to do. And by other things, I mean really like conferences, interviewing for PendelDOT, perhaps. If you can't find another, I would not suggest doing that unless you absolutely can't find another time. Class should be a priority, but sometimes things come up. I'll talk to you about illnesses. Obviously, my feelings about coming to class when you're sick has changed since the pandemic. I will still come if I've got a little cold. Obviously, I'm not going to come if I've got a flu or I'm feeling really horrible. I'll leave this to your best judgment in terms of what you feel is comfortable and safe. If I do have a cold, I'll put a mask on. You're free to wear a mask if you want. You do not have to, according to university policy, and I generally will not. In our class. I'm a low talker, and it's even worse with that. I think that's most of the university policies. If you have any questions about those at any time or anything on your syllabus, obviously feel free to ask me. Finally, you'll note at the end of your syllabus, there's 2 informed consent forms, one for me and one is your copy. I actually put the student copy, I think, on the wrong page. Oh, no, I didn't. The instructor copy is the one that you'll tear off or print off and give to me in class, please. The informed consent is just like you haven't taken ethics yet, so you haven't really learned that much about informed consent. You might have reviewed some of it during interventions. The idea of informed consent is when you enter into a contract with another individual, which is what I consider the syllabus, it's important that you take the time, you go through it with them, you have the opportunity for them to ask questions, and to understand that this is kind of a living, breathing kind of thing. So it can be modified, it can be changed with knowledge given to both parties. You could theoretically back out of it by dropping out. There's not much other ways, unfortunately, in this situation where you can kind of back out of the informed consent or the contract that you're entered into. But this is kind of, I do this purposely, and I've done it through most of my career to make students aware of this as a contractual thing, as an agreement between you and I as to what you should expect and what's going to happen, and to indicate that you've read through it, that you understand it, that you've had an opportunity to ask questions, and that you enter into this with the knowledge that you'll need, or as best I can, the knowledge that you'll need to be successful. So I do ask that by the 3rd week of class that you sign that and bring that in to me during class time.